This video is based on the following research paper and available from the following link.
Hello, my name is Professor Fatima Maryam Zahidi. In this video, we present our research about expanding the capacity, flexibility, and accessibility of our medical care system. How?
Patients go to a web-based hospital, we call it wepital, with the real avatars to receive care. So the title of our work is My Real Avatar Has a Doctor Appointment in the Wepital, a system for a persistent and fast medical care. So what is an avatar and what is a real avatar? An avatar is a digital representation of a person. A real avatar contains the information needed by a physician to provide medical care. Here we demonstrate our ideas by the story of a patient who has heartburns and goes to the wepital with his real avatar to receive medical care. His name is Pat 8 Davros.
My name is Huimin Zhao. I'm a professor at the University of Wisconsin-Milwaukee, and I will show how the project works from the perspective of a patient. First, the patient needs a wearable biosensor, and here we're using the sensor manufactured by the Medtronic company. Now I will wear this sensor on my body, and then my vitals will be transmitted from the sensor to my iPad and later on displayed in an app on my iPad. So once the vitals are transmitted, we'll see my vitals displayed in this app on my iPad. Now we see the vitals are displayed in real time. And my vitals will be forwarded to the cloud database at Medtronic. We have created software pieces to get the data from Medtronic and then store the data in our database and later on load it into the green armband of my avatar in Second Life.
So the biosensor captures the patient's vitals and sends the data to the Medtronic app on the tablet. Then the app sends the data to the Medtronic cloud database. We have developed software to get the data from the Medtronic cloud database and then send it to the patient's real avatar in our wepital. We have created a wepital or a web-based hospital in Second Life. It has multiple buildings, including reception area, auditorium, as well as physicians' offices. Physicians' offices has a number of rooms. It has a group room. It has a room for individual consultation, as well as room for holding the patients in emergency condition. When the registered patient logs into our wepital, his avatar enters into the wepital and he walks his avatar into the physician's office. The patient's avatars have arrived to the group meeting, waiting for the physician to join.
My name is Dr. Patrick Sanbanson, and I am one of the co-authors of this research project, and I am the attending physician that has participated in this research project in the past. I am in Milwaukee, and I am currently going to log in as my avatar to see patients with gastrointestinal problems, and you can see that I can be anywhere in the country seeing patients.
In this group room, the physician is seeing the patients. The physician can click on each avatar's green armband to check his or her vitals in real time. Only the authorized physician and the patient himself can see the patient's vitals, and no one else in the room. The green armband also has a link to a secure one-on-one video consultation for
each patient.
Hello, Pad 8. I am going to click on your green armband to be able to see your vital signs. It looks like your heart rate, your breathing rate, and your blood pressure are all normal. You have a normal temperature as well. Thank you, Pad 8, for showing us your vital signs. Now, Pad 8, do you have heartburn?
To preserve his complete privacy in the group, the patient answers by text.
For how long have you had heartburn?
So the interaction continues this way. When the physician wants to see the patient one-on-one in a secure video consultation, a link for this consultation is available on the patient's green armband. The physician and the patient both click on the link and start one-on-one video consultation.
Pad 8, can you remove your glasses and show me your eyes to the camera? Thank you, Pad 8. Can you raise and lower your eyelids now?
In this manner, the video consultation continues. After one-on-one video consultation is over, the physician and patient come back to group room for the discussion, diagnosis, and prescription. This process is repeated for each patient. The physician also offers general advice that apply to all patients in the group room and answers questions as patients learn more about their own and other patients' conditions.
Pad 8, based on your diagnosis of gastroesophageal reflux disease and the persistence of your heartburn symptoms, I recommend that we start a new medication. It's an acid-reducing medication called omeprazole, and we will prescribe 40 milligrams once daily to be taken 30 minutes before a meal. In addition to that, some general recommendations that I have for my patients with gastroesophageal reflux disease include raising the head of your bed while you sleep or lie down. In addition, not eating 3 hours before lying down.
This way, the patients learn from each other's experience and from the doctor's general advice and gain better understanding of their symptoms and their disease. Let us increase the contents of the real avatar with the blue armband. The blue armband has the link to the institution where the patient's medical records reside, and the authorized physician can access these records and see the allergies, medications, prior diagnosis, etc. of the patient. The physician has an orange armband which contains the physician's schedule and the list of the avatar names who he is authorized to see. The contents of the orange armband is only visible to the doctor and to no one else in the group room. By checking his orange armband, he makes sure that the avatars registered for this visit are in the room and no other avatar is allowed.
I will click on my orange armband to see the patients that are participating in today's group office visit. I see Pat 1, Pat 10, Pat 2, and Pat 8. Pat 8, now I am going to click on your blue armband. And the blue armband allows me to log into your past medical records, including your hospital records. It also allows me to check your allergies, your medications, and your previous laboratory evaluation as well. Now I'm going to click on your green armband. And your green armband allows me to look at your vital signs. This includes that your heart rate appears to be normal, your blood pressure is normal, your temperature is normal, and your blood oxygen level is within the normal range. At 8, do you have any heartburn?
Yes.
Do you have any swallowing problems at 8?
Yes, sometimes.
What time of the day do you typically have your heartburn symptoms?
And their interaction continues.
At 8, now I would like to see you for video consultation. Is it okay if I click on your video link to be able to perform this part of the office visit?
Now the physician and the patient have a video consultation one-on-one. After one-on-one consultation, the patient and the physician come back to the group room.
At 8, based on your evaluation, I feel that the most likely diagnosis is gastroesophageal reflux disease with possible Barrett's esophagus. That puts you at increased risk for esophagus cancer. To better evaluate this, we need to perform an endoscopy to further evaluate your esophagus.
Wow, that's really shocking to me. Should I get a second opinion?
At 8, if you desire a second opinion, I can refer you to my colleague, Dr. Rez Smithson, to reevaluate your situation.
Dr. Aris, this is Pat 1. I would like to know the causes of your diagnosis. Thank you.
Thank you for the question, Pat 1. There are a number of different causes for why people have gastroesophageal reflux disease with possible Barrett's esophagus. These genetic factors, lifestyle factors like drinking sugar foods and beverages. But then there are also structural issues, including a hiatal hernia, which means part of your stomach is in the chest cavity that gets rid of one of those barriers for gastroesophageal reflux. In addition, there could be a combination.
In such a group setting, the patients learn from each other's experiences. After the group meeting is over, the patient gets up, goes to the teleport area, to go to the reception area to make an appointment for the second opinion. The patient right-clicks on the teleport object and teleports to the reception area. Now the patient has arrived to the reception area and goes to the reception desk to make an appointment.
Hello, I'd like to make an appointment with Dr. Smithson for a second opinion.
Okay, I am checking your login, your blue armband. I am seeing your profile. You can see Dr. Smithson. I'm checking his schedule to make an appointment for you.
I am Reza Shakir. I am the Professor and Chief of the Division of Gastroenterology at the Medical College of Wisconsin in Milwaukee. I'm the co-author of this project, and now I'm going to see a patient for a second opinion consultation. I'm going to click on patient's green armband to review his vital signs. And now I'm clicking on patient's blue armband to review his past medical records, the list of medications, his allergies, the procedures that has been done in the past for him. Mr. Dobros, good morning.
Good morning.
My name is Rez Smithson, and I'm very happy to see you here. Tell me, please, what brings you to see us?
I have some bad heartburns recently.
How long have you had that, Mr. Dobros?
Many years, but getting worse recently.
So the current medication is not working for you?
It used to work.
This way, the one-on-one second opinion consultation continues.
Mr. Dobros, I would like to have a video visit with you, if you don't mind.
Sure.
Mr. Dobros, do you mind if I examine your throat? Could you open your mouth? And say,
And the video consultation continues this manner. After the video consultation is over, they close the window and come back to the group room in the wepital.
Mr. Dobros, I think you have severe reflux disease. And in addition, your reflux disease has caused some narrowing of your esophagus, and that's why you have difficulty swallowing. So I think you need an endoscopy. So let me click on your blue armband and order the endoscopy for you.
Because of the severity of patient's condition, the physician recommends that the avatar of the patient to be moved to the observation room. A nurse continuously monitors the health status of the patients under observation. If a patient has an emergency that is recognized from his sensor data on the avatar or from the patient alerting through his avatar, the nurse takes action. The monitor can be an intelligent robot that will alert a real nurse in such an emergency case. An example of monitoring screen is the Medtronic Omnisense website. When the sensor data is uploaded from the app on the patient side to the cloud, it goes to this live screen available for an authorized nurse to monitor. Here is an example for Pat 8, who has the sensor on, and some of his important vitals are shown on his dashboard. While in the observation room, the Pat 8's condition worsens.
Hi, nurse. I'm vomiting blood. What should I do?
Pat 8, please move your avatar to room C and keep your sensor on. I'm sending an ambulance to take you to the hospital. Your doctor will be notified to examine your avatar data and order what is needed while you are on transit to the hospital.
Thanks.
While the patient is being transported by ambulance to the hospital ICU, the physician is notified through his avatar's orange armband.
I have been informed by a message through my orange armband that Pad 8 is currently vomiting blood, and he is being taken by an ambulance to the local hospital. I am able to check Pad 8's green armband and his blue armband. His green armband shows me his vital signs, that his blood pressure is dropping, and his heart rate is increasing. His blue armband shows me the detail of his medical records, including his past history and laboratory records. Because I have access to this information, I am able to order additional tests and imaging scan before Pad 8 arrives to the hospital by ambulance. This way, we may be able to have Pad 8 avoid going to the emergency room and take him directly to the ICU at the local hospital.
A further extension of our work is to upload the health status of patients' organs to the avatar. This enables the physician to quickly assess the complete health conditions of the patient by clicking on each organ. How do patients feel about their real avatars going to the wepital? We collected data over past years, well before COVID-19, in lab experiments. Results show a relatively high level of favorable views. For example, patients' feelings about using the real avatar on a scale of 0 to 10, positive 8.6, fun 8.2, enjoyable 8.4, pleasant 8.5, relaxed 9.2, safe 9.2, satisfied 8.7. Based on the theory of affordances, we developed a model to test the success of our design and elements that contribute to it. The criterion for success is patient satisfaction. We use patient data to estimate the model. We identified the elements that can explain 85% of variation in patient satisfaction with the physician in the wepital. How does our medical capacity increase this way? At present, we have hospitals and other physical care organizations. Now we can add wepitals where patients' real avatars, doctor and other providers' avatars, and intelligent robots live. Patients stay home, so their rooms become part of the hospital. Let us call it mypitals.
Credentialed doctors anywhere can provide care in wepitals and hospitals when needed. This way, we increase the capacity, flexibility, and access to medical care. When needed, the care can be persistent and fast. Each hospital has its own wepital, but we need a wepital hub for each city or state. Why? Because we need to protect wepitals and closely supervise each for security and compliance. Each hospital can build its own wepital in the hub. The patient's real avatars can transfer from one wepital to another with full protection and ease. The wepital hubs can be connected for patients' real avatars to travel through and become part of the U.S. medical care internet. This internet needs to be protected and supervised at the federal level for security and compliance. This can become a model for other nations as well. So what are the advantages of this approach? Increased capacity of medical system. Medical care regardless of physical locations. Increase access to medical care when locally unavailable. Ease of movement from one place of care to another. Physicians' ease of access to patients' health status. Cost savings in terms of transportation, physical buildings, ER visits, etc. Patients learning from one another. Lack of physical contacts and exposure. Home care under continuous medical observation when needed. So what is needed? Secure and stable platform for wepitals and hubs, strong hacking and fraud prevention methods at each point of access, collaboration of hospitals, clinics, sensor makers, and tech companies, secure and easy way to access patients' medical records and their components, patients' access to sensor and Wi-Fi, medical standards of care in wepitals, and licensing and credentials for care providers to practice across states. The collaborators in this research project include Dr. Fatima Mariam Zahidi, it is me, Dr. Human Zhao, Dr. Patrick St. Benson, Dr. Nitin Walia, Dr. Hemant Jain, Dr. Reza Shaker, with acknowledgement for participation in the data collection for an earlier version of this work, Dr. Arash Babai, Dr. Robert Sewick, Dr. Shahriar Ahmad. Technologies used in this prototype include Zephyr Sensor, Medtronic, Virtual Worlds, Second Life, Zoom, video communication. This research was partly supported by University of Wisconsin-Milwaukee in its early stage and by John and Jean Bernes grant from the Clinical and Translational Science Institute of Southeast Wisconsin Medical College of Wisconsin. Thank you for watching.